The CDC's vaccine advisory, meanwhile, says rare reports of heart inflammation in younger people likely are associated with the mRNA vaccine.
The committee just wrapped up a day-long meeting on that concern. Dr. Frank McGeorge here to explain what they found and why they are still, though, strongly recommending the vaccine for young people. Frank?
Yeah, Kim and Devin. So the conditions are called myocarditis and pericarditis. Those are inflammation of the heart muscle itself or the lining around the heart. Now, this condition was first identified by Israeli researchers in June, and new data from the U.S. actually suggests this is a potential complication from the Pfizer and Moderna vaccines, especially in young people. But the benefits of the vaccines still outweigh the risk. The CDC says preliminary reports of myocarditis and pericarditis were rare, with a total of 1,226 cases out of more than 300 million mRNA vaccines administered. The overall rate was 12.6 heart inflammation cases per million doses. The majority of the cases were in teen boys and men under age 30. This graph shows the risk was highest after the second dose of the vaccines, and most occurred in the first 5 days after the second dose. Most cases were mild. A study of 323 of the cases found of those who were hospitalized and discharged, 79% had fully recovered, 9 remained hospitalized. The CDC experts noted that heart inflammation is also a risk of contracting COVID, and cases are disproportionately affecting young people now. Adolescents and young adults now have the highest rate of COVID-19 infections. Getting vaccinated dramatically reduces the risk of hospitalization, death, and long-haul symptoms. This chart shows the number of COVID-19 hospitalizations that would be prevented with the vaccine in each age group versus the predicted cases of myocarditis. Even though the risk of heart inflammation from the vaccine is very low, committee members stressed it is important to be upfront about the potential risk with young people and their parents. Now, there was no vote at today's advisory panel meeting, but warnings about myocarditis will be added to the vaccine fact sheets. The CDC will continue to collect data and analyze the identified cases to see if there are any further bits of information that can be gained about the potential risk. It's good health. Back to you.